Hello, 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 everybody. Can you hear me? I have my comments a little bit delayed on the computer because I'm using StreamYard today, and I do have to look on my phone to see. Uh, I have to turn this down. I have to look on my phone to see the comments. Yes, thank you at two pineapples. So I'm still waiting a little bit. Let's see if we're gonna get more people to come in. Guys, you can connect. If there's someone in the chat you don't know, check out their channels. You might wanna be their friends as well. If you're new here, just subscribe, like our video, share. It helps a lot. It helps the channel a lot. Turn this down too. Thank you, Atu Pineapples. Thank you, Talkbear. Thank you, Little Frenchie. Thank you guys for always showing up for me. Can you hear me? Can you hear me? Okay, that's good. That's good. Maybe we can start like at one, maybe 135, 140, and just see what everybody has to say about the topic of discussion today. Look at the banner. Come on in, guys. Come on in, everybody. I can do a lot more with StreamYard, but I also miss my YouTube screen because I just noticed I cannot like put moderators on here, and I do want to have some moderators, so I have to check that out. Check that out. Yeah, it is different. Hi, Jeff. I just noticed you came in. How are you? Thank you for the 4 people who are here. If you're new here, don't forget to subscribe like, share out the screen. It does help a lot. It does help a lot, you know. And this is Little Ruby's Daycare Encounters YouTube channel. And our goal on YouTube is to emphasize play based learning, wellness, and research based solutions to issues in early childhood education. Our topic for today, I think you can see it is scrolling on the screen. Our topic for today is the impact of COVID-19 on daycare. And I was lucky the last time I had a live stream. I had a live stream. I had uh, I had somebody here in the chat section, and he said that would be a great topic for you to discuss. And I was like, yeah, it will be. And I had done some research, and I mean, it's amazing how much COVID-19 has impacted the world generally and education in particular. And then going down to the very level of daycare. I mean, it's been amazing. It's been amazing just reading about studies and seeing how this is impacting daycare, at all levels. It's not been it's not been pretty. It's not been pretty. So I'm gonna go right ahead and start. And I do want to say again, thank you all for coming. Thank you, Talkbear, Little Frenchie. Thank you, Two Pineapples, and everybody else, because I do see that I have 5 people here. Not everybody is on the comment section, but I appreciate all of you for coming. And, I'm glad we're here together today to discuss this very important topic. And I do see that Jeff is here as well. So, um, I'm gonna put something up on the screen. I love to use StreamYard because you can actually do more, with StreamYard. So I do have something from, let's see if I can find it, from NACI. And if you're not familiar with NACI, NACI is the National Association for the Education of Young Children, and they have a lot of research about this topic we're talking about today. And I do want to show that. See if I can get there. I do want to show that, and also I do want to share my screen so we all can see it. So it does say, see if we can get that here. And when I'm sharing my screen, I cannot see the comment, so I'll just use my phone as well. Okay, so National Association for the Education of Young Children. I did get this from their website, and this was from April 17, 2020. And we can see the topic. It says from the front lines of the ongoing from the front lines, the ongoing effect of the pandemic on childcare. And here, childcare is the backbone of our nation's response to disaster and the road to recovery. Yet, programs and providers are in crisis, and their viability, and therefore, the viability of our nation's economy is dependent on substantial, additional, and direct investment from federal and state governments. So it's quite a long publication, with not too long, like it's 2 pages, uh, and there's a lot of information here that I'm very interested in. Hi, Scratching Pete, I can see you. Thank you for stopping by. So we can see here it says an initial study, an initial survey, and that's one other major thing why I really, really love NACI. They will go down to the basics. They will do research. They will show you the numbers. as it relates to early childhood education. So I'm not gonna read everything, just a couple of spots that caught my attention here. Hi, healthy food, kitchen. Okay, so it says from April 2nd to 10th, more than 5,000 providers responded to the survey from all 50 states, the District of Columbia, and Puerto Rico. 54% of respondents work in center based childcare, and another 31% work in family childcare homes. Together, these survey respondents alone serve upwards of 215,000 children, and this gives you a scale of how important childcare is for the community, for the environment, for the society, for the United States, and all over the world globally. Okay, so now look at the statistics. Look at the statistics, guide. It says nearly half of respondents report that their center is completely closed. Let's bear in mind this was in April, because things are kind of different now, and we'll still see. There's more research I'm gonna show to show you like the current status of what's happening at daycare. Now it says 17% are close to everyone except children of essential personnel. Of the remaining programs, only 3% are operating without modified rule. Okay, so now there are geographical differences where 51% of programs in cities and suburbs report that they are completely closed. 40% of programs in small towns or rural areas say the same. Okay, now I want to move on to more numbers here. Okay, now it says right here, it says of programs that remain open in some way, 85% of respondents reported that they were operating at less than 50% of their enrollment capacity. Can you imagine? Can you imagine what that means financially? Can you imagine what that means, with regards to the program? Can you just imagine the scale of that number, you know? Um, and the majority of those 65% were operating at less than 25% of capacity. So further, most programs, whether open or closed, are unable to recoup their normal revenue from families. Look at that, who pay for childcare without assistance. And that's an important thing to consider as well. The daycare programs are suffering. Families cannot even meet up the demands, to pay for daycare because many families lost their income, especially at the beginning of the pandemic. So, right here it says 52% of childcare centers and 43% of family childcare homes are not currently charging parents. Another 22% of both groups are offering reduced tuition, regardless of what actions programs are taking. However, the majority of respondents have found that fewer than 25% of families are continuing to pay tuition. I do want to take some of this right here and see if I can paste it right here. Okay, so for now, I'm going to stop sharing my screen and come back and see if we can put that up on the screen. See if I can put that up. Because those are important numbers, to consider. I want to say Lacey. I just want to put this up here, you know, and I want to give credit to Lacey for these statistics. and this was April 2020. So we can see if there have been any changes since April, you know, and I'm gonna just let this work here. Okay, I got it. I got it. I have to get used to this live streaming thing, but what personally, let me ask a question, okay? So personally, from your point of view, um, people who are watching currently, how has COVID affected you personally? And if you have to deal with childcare, how has that influenced you in childcare? Or if you know somebody who this has influenced, in how has that, I don't know, negatively mostly impacted childcare of your family members, of you, people your neighbors. What do you think about the impact of COVID-19 on childcare generally? Now, while I'm waiting for some answers to show up on the on the chat section, I do want to put up another very interesting article that I'd found. See if I can get this, because I do want to keep an eye on the I want to keep an eye on the comments as well. Keep an eye on what else is happening on the screen here. So that was Nacy. I want to show you another article. This is from the Washington Post. I do like to show evidence and research, you know. Hey, hi, Valentina family, Dubai Life. I see you. Thank you for stopping by. Guys, don't forget, if you're not connected to anyone here on the stream, uh, go check them out. Go check them out. See if you're interested in their content, and then, you can connect. Okay. So I want to go to another article that I found very interesting. But let me share my screen again. So pardon me, pardon me, friends. This is kind of new to me, so I am trying to get used to it. Okay. So share screen again. I'm gonna do everything with the audio and this. I want to go to um, I'm wondering if you can see me. Okay, yeah. So I'm going to go to another article from the Washington Post. Okay. Now this says COVID-19 and childcare. What the latest research says. Okay. Put this away. We don't need that. Okay. This is more recent, guys. This is by Alison Chow, and this is from October 2020. So this is very, much recent than the last one we just did with Nacy, which was in April. And I'm pretty sure that Nacy has updated data. I just didn't check that yet. Okay. So this says, although sending their offering back to daycare will provide a welcome respite to parents who are both working and caring for young children, many have been um, hesitant, fearful of exposing their children and themselves to the novel coronavirus. Okay. Hi, Makeup Mom and Son. Thank you for stopping by. I appreciate you a lot. Okay, you said I've had both of my vaccines done. I work at a hospital. Yeah. And actually in my state currently, they're working on that. Daycare providers are very close to the top of the list, to get the vaccine, just right along with the medical team. Hi, Declan fans. How are you? Thank you for stopping by. Thank you so much, guys. I appreciate this. Okay, it says questions remain about how the coronavirus affects children, how safe the programs are for children and their families, which procedures work best to mitigate the spread of the virus and its disease, COVID 19. Okay, so let's go to numbers. Okay, I like to see numbers because numbers tell you everything. So, since the beginning of the pandemic, more than, check those numbers, guys, more than 741,000 children in the United States have tested positive for the coronavirus. And according to recently updated data from the American Academy of Pediatrics, as of October, about 100 children and teenagers had died of the disease. And bear in mind, guys, this is January. So that's not too long ago. That's like yesterday. A small portion of the country's total death toll, which has now exceeded 221,000, you know, like adults. Children with certain underlying conditions, including obesity, my whole department has had theirs. No one had anything major except one girl, and she has arthritis bad. So it hit her joints a lot. Oh, wow. That's interesting to know. And they do tell you when you get the, before you get the vaccine, you have to talk to your doctor. I heard that if you have allergies, and, you do have to talk to your doctor before you take it. So, and you never know how it's going to affect you. You can never predict. Just like the disease, also is the vaccine. But everything is chance. Take a chance in life. So there have also been cases in which children and teens have developed what doctors are calling multi-system inflammatory syndrome, or I have joint issues too, but only had some more. Wow. I do, those will probably go away. They might just be temporary, right? Okay, so MIS dash C in infants and preschoolers. This is my concern right here. Infants and preschoolers, as it relates to daycare. The symptoms are similar to Kawasaki disease, a rare illness with an unknown cause that typically affects those younger than 5 and can lead to inflammation of blood vessels. MISC has caused at least 20 deaths, according to the Center for Disease Control. Guys, check the numbers. Guys, check the numbers. But experts say, I just had to move further because we can't read this all. But experts say the amount of virus in young children doesn't necessarily mean they are major sources of infection. And data on their risk of transmission has been scarce. Yeah, yeah. Okay. Is it safe for young children to be in childcare? Great question. Great question. I want to see. Glad to know it is under control at Valentina family, Dubai Life. Europe is not doing great right now. Wow. Okay, so the results of studies examining the impact of childcare programs on community spread in the United States have been mixed. I don't even think they have enough data on that yet. I think they're still working on data, about childcare programs, and we'll really never know the full impact for a while to come. But also it's encouraging that that way, people are working on this, people are checking numbers, people are checking, they're tracing to see how COVID-19 is spreading, and also see how it impacts all parts of life, all over the world, not just in America. We're going to do Russian one. Oh, wow. It says, this is Valentina family. It says at Little French in Big Texas, they bought vaccine now. Pfizer, German, American, and Sputnik V, Russian. Okay. So in September, the CDC published a small study of contact tracing data collected from 3 childcare centers in Salt Lake City from April to July, and found that a dozen children, 12, probably contracted the novel coronavirus at the facilities and went on to infect their family members. Wow. Guys, check this data out. Transmission was also linked in two children who had confirmed asymptomatic cases. Outbreaks at two of the centers were traced to staff members who were exposed to the coronavirus through their family members. But the source of the outbreak of the third facility was not identified. The researchers wrote, according to the report, all the programs had varying safety measures in place at the time. Wow, you know, COVID-19 is one crazy disease, you know. You have to be like extra doubly, triply careful, not to catch it, especially when you have a group of children and a group of families. I want to read what makeup mom and son says. My son was at daycare when school was closed, and they only had one person 2 weeks ago that was positive. They closed down, sanitized, tested all staff. Only one, oh wow, only one positive. Okay. And um Valentina family says at Little Frenchy in Big Texas, yeah, but here it's mandatory to do so. So just choose the vaccine. Yeah. Okay. So these okay, let's go to more numbers. More than 90% of survey respondents who worked in facilities that stayed open reported practicing good hand hygiene among staff members and children and frequently disinfecting indoor surfaces and fixtures. Other safety protocols included keeping group sizes small. Yep, an average of 6 children in home based programs and cohorts of 8 in center, symptom screening and social distancing. These childcare programs were doing Herculean efforts. Oh my God. You're talking about Hercules? Yeah. To keep children safe, said Walter Gilliam, the paper's lead author and a professor of child psychiatry and psychology at the Yale University Child Studies Center. He added, could you imagine cleaning and disinfecting every surface and fixture in your house 3 times a day? Did you say 3 times a day? We probably do it here like 10, 20 times a day. You know, children, especially at a very young age, they are still learning all kinds of skills, especially social skills. And when they cough or sneeze, sometimes they forget to cover up. So the sneeze is all over the floor, all over the table, and you're rushing, just constantly aware, constantly fearful, and the way the disease is, you never can tell who has it. So that's why you have to be extra careful. Okay. It is incredible the amount of effort that they were going through. Okay. I am going to leave a link of these articles because there's amazing information here that you might want to look at. So at the end of this stream, I'm going to leave different links to these articles so you can go back and read them. So now let me go back to the screen. Let's go back to the screen. Um, I'll stop this and I want to read some of these comments as well. Okay. So this is see where I had stopped. Okay. Home You're homeschooling yours, little Frenchie. Yeah, I do see some of your beautiful homeschool videos. I tried virtual academy, but was not working. Okay, now virtual learning has been a huge problem, with kids, especially preschoolers. Preschoolers are used to one-on-one, face-to-face, physical learning, and that's what works for them. But now imagine how they have to now start adapting to virtual learning. And why am I saying preschoolers? Not just preschoolers, even elementary school students. You know, how these virtual teachers are doing it. I do watch some of them on YouTube here, just wondering how they're working this out, how they're teaching these children from from screens. It's not easy, but some teachers have been very creative about it. But we still long for face to face learning for young children. So um, I'm a healthcare worker and a single mom. Okay, I had to work and send him back, and that's makeup mom and son. Okay, and that's San Antonio. Wow, yeah. It doesn't even matter where you are. COVID-19 is everywhere. Um, Houston area too for little Frenchie. Makeup mom. You say your neighbors. Okay, yeah. Um, at little Frenchie in big Texas, in your house now, we keep keep for you a surprise. Okay. Yeah. We like surprises, good surprises. Okay. I'll return the favor. Virtually teaching kids how to read and write. Yeah. Tell me about insanity. My son did bad with virtual learning. His teacher was nervous but was amazed by how good he is now that he's in person at school. Yeah. Yeah, in-person learning is amazing, but unfortunately, looks like we're gonna be doing um, hybrid learning for a long time. And the thing is, at one time, the disease had subsided, and many school districts were like, "Let's get back to school," and it came right back, you know, and schools had to close, and they had to start the hybrid thing. Now, think about think about virtual learning and special needs. Think about that, and think about how those two kinds of learning don't even work together. They are not, they cannot really easily be synchronized. Because special needs children need more than children who don't have much of those needs. They need more physical contact. They need more dramatics, more theatrics, when teaching them. And they have all kinds of, unique learning needs that virtual learning may not be able to provide. Okay, so yeah, it is. It is. This is Valentina Family, Dubai Life, and you're saying that virtual learning is not proper education. Hope kids will be back to school faster. Yeah, yeah. I agree, and they miss the social interaction. Oh my goodness, the social interaction part, is the biggest part. They are friends. And think about young children who are still learning to cope with social interactions, who are still learning to make friends, to have conversations. Think about how virtual learning affects them. Virtual learning programs, most that I've seen, are geared towards teacher control. Mostly, like, the students have no control over the learning. So teachers have to, is not teachers have to, like, plan it from the beginning to the end. I mean, we do plan our lessons as teachers, but in virtual learning is more at more advantageous to have your lesson plan. So you are not the teacher has become the major authority again, and this is one thing that research has been advocating against for a long time. So, but now with virtual learning and with the pandemic hitting the society, teachers have once again become the total authority to learning when they do virtual learning. Because how do you let children take control? You know, um, Even if they do, it's gonna be minimal control, not as much as, like, a child-centered learning environment would prescribe. Okay, yeah. Little Frenchie in Big Tessa says, "I'm lucky to have twins. They interact a lot." That's good. Yeah, you're lucky to have multiple children living together. But at the preschool level, at the daycare level, where I work, where I am an expert, very many of the children who come to daycare are single kids. They don't have siblings, you know. So, uh, how does that work if you have to do virtual learning? Now, I don't want to talk about me personally. Since the pandemic, luckily, I have not had to close. I've been open. I closed once for cleaning, like thorough cleaning, and that was it. And I haven't had to close except for holidays. I haven't had to close since the pandemic. So I would say that me and many others who've been open um, have children who are lucky, to still be able to have that group of children they've been with, to have the social interaction, to have the one-on-one, face-to-face learning. I can tell you things are different. Things have changed at the daycare, currently at all open daycares, but we still have that personal interaction, with the children in our care. So I do want to, oh man, thank you, little Frenchie. Uh, I want to go to another study that I have. I do have to go there and see. I think that was from. Let's see if I can find it. See if it's this one. That was from Time. Yeah. Okay. I want to see if I can do that thing I just did again, the screen sharing thing. And here we go. Do that. Do this. Yep. And then come here, put this in. Okay. Now watch this, guys. It says COVID-19 has nearly destroyed the childcare industry. Nearly. And it might be too late to save it. Okay. So the childcare industry is rapidly becoming extinct, just like dinosaurs. That is if nothing is done to save that industry. Now, this is from Time, and this is by Abby Visalis, and this was in September 2020. This is another like recent article on the impact of COVID-19 on childcare and daycare. So here's I love this article because it does have a real human story in it. When I was reading it, I was like, oh my, I felt so bad. Okay. Now this is Jenna Antico. Excuse me. It's it says Jenna Antico, a 31-year-old childcare operator in Sarasota, Florida, thought 2020 would be a pivotal year for her business. The daycare facility she started building in 2015 was turning a steady profit. So she leased a second building in October 2019, then purchased a third in late February. This is someone investing in her future. This is someone hoping in her future, right before the pandemic. Okay. So I'm going to skip that. And then when COVID-19 hit the United States like a tsunami, that's a great description. It hit it like a tsunami in March, shuttering schools and businesses and prompting companies to start working remotely. Daycares like Antico's got caught up in the current. Thank you, little Frenchie. Thank you so much for stopping by. Thank you. I will see you in our next live. Don't forget to hit the like button on your way out, okay? I know we're connected already. So let me keep reading. It says parents pulled their kids from the centers and local governments began issuing strict guidelines that providers will have to meet before they could welcome children to meet both the Florida State and Centers for Disease Control and Prevention CDC recommendations. Now, watch this. So, you're not only dealing with state guidelines, you're also dealing with the CDC guidelines and sometimes personal guidelines. So, Antico erected four new walls at nearly 8,000 a pop, more investment into a business that is really not, giving returns. Okay, to reduce the number of kids per classroom, purchased 16 portable sinks for 2,800 and hired 5 sanitation workers to deep clean her original center for 3.5 hours. Oh my, every night, every night. She's also paying her administrative assistant overtime to keep up with all the new documentations. But despite these investments, enrollment at her facilities and therefore Atiku's income hasn't rebounded in the way she had hoped. Okay, so she's losing money and still putting money into the business. At the beginning of 2020, watch this, her facility was just shy of its 106 kid capacity. By the end of August, only 49 children were enrolled. Okay, just think of the devastation. Okay. Thank you, Valentina and Valentina family. Um, Now that let's I think I missed something. Okay, it says Antico is hurting, just like many daycare providers. She has already blown through the entire 91,000 paycheck protection program loan she received through the CARES Act, accrued an additional 70,000 worth of debt, and both of her new facilities remain vacant. She has no funds left to staff or furnish them. I'm so sorry about what this lady Antiku is going through, you know, and it's sad that this is a general problem across the board. Okay, so interviews with more than half a dozen daycare operators from across the country. This is more statistics, okay? Reveal why so many centers may never reopen. Even before the pandemic, they said overhead costs were immense, whereas profit margins were just enough to get by. In this pandemic era, everything has simply gotten worse. Okay. Lauren Brown, the director of World of Wonders Childcare and Learning Center in Marysville, Ohio, says clinic costs have skyrocketed 300%, while the center grossed 20,000 less in June and July than it normally would. Annette Gladstone, the co-founder of Sigray Eagle Rock Daycare in Los Angeles, says she is struggling to keep up with rent on her daycare building since enrollment is so low. Wow. Segre Eagle Rock normally accommodates 177 children. By late August, it had 2 dozen kids. Check these numbers from 177 to 24. Despite this blistering Southern California heat, Gladstone has kept the windows open while the air conditioner is running because the CDC indicates the practice can increase ventilation. Meredith Carsten, who runs the Early Childhood Center in Greensboro, North Carolina, says the demand for her services all but dried up. Our waiting list used to be a year long, she says, is now empty. And I am going to leave links of these articles so you can read them. I'll just skim through because there's a lot of information, there's a lot to learn from here. Okay, so it says here we're in fast moving vehicle towards destruction. Imagine using these words to describe your industry. you know just imagine how that feels. We are in a fast moving vehicle towards destruction. Back in Sarasota, Antico is about 2 months away from pulling the plug on her daycare business. If enrollment numbers don't jump, she says, she won't have much of a choice. If I get to a place where I don't think that I can pay the next payroll, I'll put it up for sale quickly at an attractive price, she says. Okay? So here we go with some more statistics here. Um, I want to read this part. Okay. Democratic presidential nominee Joe Biden has since called for a combination of tax credits and subsidies that would ensure families earning less than 1.5 times the median income in their state aren't having to spend more than 7% of their income on childcare. Yeah. So um, well, you can go back and read this article with all the important details in it, and then you can see the the naked truth, the naked truth about what's happening to the daycare industry. You know, I just want to put a little stuff up here. Okay. Okay. So now talking about my personal experience about this daycare issue. Since the pandemic, like I said, I haven't had to close except for one day at the very beginning, just for cleaning. And the it wasn't that I wasn't scared, because at the initial stage, like around that March last year, nobody knew much about the disease, you know, until like towards the middle of the year, where we started learning about social distancing, mask, um, and all of that, hand washing, and all of that good stuff. So naturally, as a childcare provider, we're trained to avoid all kinds of diseases just by hand washing, because hand washing is the single most effective way to prevent most kinds of diseases. Okay, communicable diseases especially. So we as childcare providers, we wash our hands multiple times. So that wasn't hard to adapt to. That's something we constantly do. That's something we are constantly used to doing, washing our hands. But there were other things, that came up that we had to deal with. The one thing, I do have some notes here. Okay, one impact on daycare was the fact that we had to, instead of doing mostly group activities, like learning activities I'm talking about, we now had to create individual learning situations for children. For instance, I want to give an example. For instance, when it came to like sensory activities, you know we just had a sensory table, or like a sensory area where all the children could go and feel and touch and play. Like if you want to do like water bills, water beads. For instance, we had water beads in a bowl, and all the children could go and touch it and play with it. But with COVID-19, with the pandemic, we can no longer do that. So that's not like mostly part of state mandate, state guidelines on COVID-19. You have to engage the children in individual learning activities most of the time, unless when you think it's safe to do group learning. And also, little children in some places as young as 2 year olds now have to have masks on. Providers now have to have masks on. You know, parents are restricted from coming into the daycare space. Here, my parents do have to come in, sometimes get their coats, get their children dressed to go home. So they have to have a mask on if they're coming into the daycare space. There's a sign at the door that says mask beyond this point. All right. So with the social distancing aspect, we're dealing with little children, and it's very, very hard, almost impossible, to social distance a child. You're changing their diapers, or wiping their faces, or cleaning them, or changing their clothes. That's really, really hard to social distance from a child. So that's something we are having to adapt to. Um, Cleaning, you know, as a daycare facility, home, or center, we are used to cleaning just like we're used to hand washing. But now cleaning has become, uh, something of a like something that you have to do constantly, almost every time. You know, like a compulsive thing. If a child sneezes, you quickly clean. If they spit, you're quickly cleaning. And we have now had to um, make most of our learning activities outdoors. It used to be a lot of outdoors here at Little Ruby's, but now more of our activities are outdoors. Okay, so COVID-19, the pandemic, has come and has hit various aspects in a very negative way, you know. But for the childcare program, for the daycare provider, it's like the future is very uncertain. Future is very uncertain. You know, Parents lost their jobs, they cannot afford to pay the daycare providers. Daycare providers have to keep their doors open. They have to pay bills. Bills are not changing because they don't have enrollment. They have to pay light bill, they have to pay water bills, they have to pay mortgage or rent if they need to keep their doors open. And unfortunately, um, things are really not working out. Because if you don't have money, how are you going to pay? And if you've lost your job, how do you get income? So, my next big question is, what is the future of the daycare program? What is the future of the childcare environment? You know, what's going to happen? Um, are things going to be different? Is uh is is the pandemic, I mean, we are getting the vaccines, so is the pandemic going to be under control or totally eradicated in about 10 years? And if it is, then what? For the childcare provider, what's next? We keep hearing reinvent your program as it relates to the society at a particular time, and all of that. But reinventing childcare might not be as easy as reinventing somebody working in the technology arena. Okay, so I do think that this was an amazing, and I'm gonna keep saying amazing topic today. And I learned a lot, from some of the chat members, and I'm very grateful that you stopped by. I do want to do this more often, bring up a very nice topic, and talk about it on YouTube. I want to put something up. Okay. Um, you can always connect with me on Instagram at Little Rubies, on YouTube, on Facebook. Check me out. Check out my um, check out my social media and follow me. If you follow me, especially like on Instagram or Facebook, I'll follow you right back. Okay, and let's keep these conversations going. Let's keep childcare. Let's leave a light on childcare, because it is very important, on daycare programs, on childcare programs. Um, let's keep having these conversations. Okay. And if you're an educator from any part of the world who wants to connect with me on WAGE, which is World Advocacy for Growth in Education, that aspect of my YouTube channel is dedicated to interviewing educators from all over the world, just learning about their systems and what they're doing, and relating it with whatever is happening in the community, in the world currently, especially like COVID-19. So if you want to participate in that program, reach out to me. My email address is brendachildcare123@gmail.com. It's free. You don't have to pay me anything. You know, reach out to me on my email and let's see if we can have a chat. So, once again, I want to say thank you all for stopping by today. I appreciate every one of you who stopped by. I still have two people on the chat. Thank you so much. I appreciate you, and I just want to say I love you all for the support. Love you all for the likes, for the shares, and peace out.